Meantime, weekly insights on COVID-19 remain an important tool in reducing cases across this country. However, Deputy Chief Medical Officer Dr. DeLon Brennan says the country will remain on an uphill battle against the coronavirus due to a struggling healthcare system. Here's Lloyd Allen.
As the nation moves beyond the 6-month mark into the fight against COVID-19, data analysis of cases, symptoms, recoveries, and even deaths are proving key to better understanding the virus's effect on Bahamians and, even more importantly, making the most effective defensive move to protect the public. Deputy Chief Medical Officer Dr. DeLon Brennan explains.
Rather than just looking at, we got this amount of tests that were reported today, are those tests based on what's happening right now? What were the specimen collection dates? How much symptomatology are we seeing out there? Are these people who are traveling? Are these people who are really ill? It's giving us a lot more idea as to what's going on with the disease. And that helps us to target our messaging to the public. It helps us to target what our supplies, equipment, our infrastructural needs actually are, what our human resource needs are. So the analytics definitely are getting us a much better picture of what's going on with COVID-19 in the Bahamas. And that can only be of a help to make sure that we can get things under a little better control.
Brennan added that along with new data compiled, indicators months ago suggested an increased death rate during the now second wave.
We knew that with the spike in cases, with the rise in cases that was coming, that with our, not just with opening of our borders, but also with the movement of people and, not necessarily adhering to the measures that have been advised and put in place, we could predict that we were going to see a large number of cases that were going to come along, and we saw that. We knew that if we didn't implement, some of the more restrictive measures, the likelihood is that we would see increased numbers of hospitalizations and, unfortunately, more deaths.
And while the goal is to minimize new cases, Brennan says a less than ideal medical system in the Bahamas remains concerning to health officials entrenched on the front line of the pandemic.
Our health system is strained, and we need to make sure that we keep our numbers as low as possible because, the more cases you get, which is going to lead to a higher number of people who are really ill from the disease. We have a really sick population with high rates of chronic non-communicable diseases. And then, we have an older and aging population. So you're going to see individuals who are young with diseases who then get affected by COVID that are going to be ill. We're going to see older individuals who may or may not have chronic diseases, and they're going to get ill. And unfortunately, some of those individuals are going to die, and we need to take it seriously because, these are family members, these are brothers and sisters, these are church members.
Lloyd Allen, ZNS Network News.